Do lockdowns work? Are they effective in reducing transmission of the virus and thus in reducing COVID deaths? This is a question that has haunted scientists, politicians, epidemiologists, and even the public at large. COVID skeptics have for long tried to make people believe that COVID is just a cough and a cold, and sometimes a bit of a fever. Meanwhile, public health experts have sometimes even tried to convince the masses to take extreme measures to prevent COVID. But the answer to the questions I asked at the beginning of this video lies somewhere in between. Many studies have concluded that the strict lockdowns that were imposed by the governments globally did reduce COVID-19 deaths. Most researchers and experts agree that at that time the governments had no other option. The threat was something they had never encountered before, and the lockdowns gave them the time to prepare for the fight against this new virus. If governments had not done so, an overwhelming number of the sick would have caused the healthcare systems to collapse. But then there are those who believe the governments went too far. They believe that the lockdown had a huge economic cost that eventually translated into human cost. Education was disrupted. People faced mental health issues. Keeping all this in mind, let's look at the various studies on lockdown and what they say. First up, study by CDC, or the Center for Disease Control and Prevention, which is the National Public Health Agency of the United States, which was published in the agency's Morbidity and Mortality Weekly Report in January 2021. It concluded that countries that implemented more stringent mitigation policies earlier in their outbreak response tended to report fewer COVID-19 deaths through the end of June 2020. These countries might have saved several thousand lives relative to countries that implemented similar policies, but later. This study was based on the experience of 37 European countries from Jan 23rd to June 30th, 2020, the early months of the pandemic. Now let's talk about the other study. A working paper from Harvard University's Center for International Development, which looked into 152 countries from the beginning of the pandemic until December 31st, 2020, found that lockdowns tend to significantly reduce the spread of the virus and the number of related deaths. But the effect fades over time. So lengthy lockdowns or second phase lockdowns like the lockdown 2.0 that we had in our country don't have the same impact. And now another study from the University of Zurich, Switzerland. A study published in World Medical and Health Policy in November 2020 that looked at whether 24 European countries responded quickly enough found that the fluctuating containment measures from country to country and over time prohibited a clear association with the mortality rate. But it said the implementation speed of these containment measures in response to the coronavirus had a strong effect on the successful mitigation of fatalities. Which basically means, in simple language, the quick response which changed according to the situation, but it was too dynamic or quick changing to make any correlation with death patterns. But lockdown comes with a heavy price in terms of livelihoods and also social inequality. To explain it in monetary terms, understand this. A study estimated that India lockdowns from April to June 2020, India's GDP dropped by more than 24%. During India's first stringent national lockdown between April and May 2020, individual income dropped by approximately 40%. The bottom decile of households lost 3 months' worth of income. So what was most problematic was the poor got poorer and the middle class shrunk. This led to an increase in economic and social inequality. While most studies concluded that lockdown is most effective if it is imposed swiftly and stringently, the argument remains, what if the response turns out to be more than what is needed for the virus at that time? What if it is an overreaction? Will it be prudent to push your population into economic hardship because there is a possibility of increased deaths? Also, what about the length of lockdown? While studies have concluded that if countries like UK had imposed their lockdown earlier, they could have prevented deaths or maybe reduced the number of deaths. But then Countries like China have proved that extending severe restrictions for extended periods of time can be counterproductive. So, my analysis says that lockdown is not an easy decision for any government, and it would take a lot for the Indian government to impose it once again. It's just too expensive in terms of economic and also human cost. Do tell us what you think about this video in the comment section, and for more news updates, subscribe to India Today.